This medication is prescribed to reduce the risk of death in individuals with a specific rare condition called Hutchinson-Gilford Progeria Syndrome, HGPS. It is also used to treat individuals with other rare conditions known as Progeroid Laminopathies. Lonafarnib works by decreasing the amount of a harmful substance called progerin, which is caused by these conditions. As for the dosage, Zokinvy 75 mg capsule is typically taken once daily, with or without food. It is important to take it at the same time every day to maintain a consistent level of the medication in the body. It is best to consult with a healthcare professional for the best time to take this medication. The benefits of this medication include reducing the risk of death in individuals with HGPS and treating other rare conditions such as Progeroid Laminopathies. It is important to take the medication as prescribed by a healthcare professional to achieve the best results. Before you start taking Zokinvy 75 mg capsule, make sure to read the patient information leaflet and instructions for use from your pharmacist. If you have any questions, ask your doctor or pharmacist. Take this medication by mouth as directed by your doctor, usually twice a day, once with the morning meal and once with the evening meal. Swallow the capsules whole with water. Do not crush or chew. If you have trouble swallowing the capsule, it may be opened and the contents mixed as directed in orange juice, applesauce, or certain liquids used to make a suspension. Swallow the mixture within 10 minutes of mixing it. Do not save the mixture for future use. Avoid eating grapefruit or Seville oranges or drinking grapefruit juice while using this medication unless your doctor or pharmacist says you may do so safely. Do not mix the contents of the capsule in juice containing grapefruit or Seville oranges. Grapefruit and Seville oranges can increase the chance of side effects with this medicine. Ask your doctor or pharmacist for more details. The dosage is based on your medical condition, body size, response to treatment, and other medications you may be taking. Be sure to tell your doctor and pharmacist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. Use this medication regularly to get the most benefit from it. To help you remember, take it at the same times each day. Do not increase your dose or use this drug more often than prescribed. Your condition will not improve any faster, and your risk of serious side effects will increase. Some common side effects of Zokinvy 75 mg capsule Progeria syndrome treatment agents include nausea, vomiting, diarrhea, abdominal pain, gas, constipation, decreased appetite, tiredness, headache, muscle/joint pain, or mouth sores. If any of these effects persist or worsen, consult your doctor or pharmacist. It's important to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the risk of side effects. Many people using this medication do not experience serious side effects. This medication may also raise your blood pressure, so it's important to monitor it regularly and inform your doctor if the results are high. Be sure to contact your doctor immediately if you experience any serious side effects, such as unusual weight loss, signs of dehydration, signs of infection, easy bruising/bleeding, unusual tiredness, or mental/mood changes. In rare cases, a serious allergic reaction may occur. Seek medical help right away if you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects. If you notice any other effects, be sure to contact your doctor or pharmacist. For medical advice about side effects in the U.S., you can report them to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before starting Lonafarnib, it's important to let your doctor or pharmacist know if you have any allergies. This medication may contain inactive ingredients that could cause allergic reactions. Also, be sure to inform your doctor about your medical history before using this medication. If you have any upcoming surgery, make sure to inform your doctor or dentist about all the medications you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant or planning to become pregnant, you should not use Lonafarnib as it may harm an unborn baby. Talk to your doctor about reliable forms of birth control while using this medication. It's important to discuss the risks and benefits of using this medication if you become pregnant. If you are breastfeeding, consult your doctor before using Lonafarnib, as it is unknown if this drug passes into breast milk. It's important to be aware of potential drug interactions that can affect how Zokinvy 75 mg capsule Progeria syndrome treatment agents work in your body, as well as increase your risk for serious side effects. This may include interactions with other medications like adagrasib, azole antifungals, belzutifan, butalbital, cenobamate, ivosidenib, lefamulin, rifamycins, ritonavir, secobarbital, sotorasib, and triasulfan. It's crucial to keep a list of all the products you use and share it with your doctor and pharmacist, and to not start, stop, or change the dosage of any medicines without your doctor's approval. Additionally, Zokinvy 75 mg capsule Progeria syndrome treatment agents can also slow down the removal of other medications from your body, which may affect how they work. This includes medications like daridorexant, elacestrant, finerenone, mavacamten, midazolam, pacritinib, sparsentan, and certain statin cholesterol drugs. It's important to discuss all potential interactions and concerns with your healthcare provider. If someone takes too much Zokinvy and experiences severe symptoms like losing consciousness or difficulty breathing, it's important to seek immediate medical help by calling 911 or a poison control center. In the U.S., residents can contact their local poison control center at 1-800-222-1222, while Canadian residents can call their provincial poison control center for assistance. It's important not to share Zokinvy 75 mg capsule with others. Your doctor may also request lab and/or medical tests, such as liver/kidney function, complete blood count, hemoglobin/hematocrit, blood mineral levels, and eye exams while you are taking this medication. Make sure to keep all of your medical and lab appointments. If you happen to forget a dose of Zokinvy and realize it more than 8 hours before your next scheduled dose, you can take it with food as soon as you remember. However, if it is less than 8 hours before your next dose, it's best to just skip the missed dose and take your next dose at the regular time. It's important not to take a double dose to make up for the missed one. It's important to store Zokinvy 75 mg capsule at room temperature, away from light and moisture. Be sure to keep it out of the bathroom and away from children and pets. When it's time to dispose of the medication, make sure to do so properly. Don't flush it down the toilet or pour it into a drain unless instructed. Instead, consult your pharmacist or local waste disposal company for guidance on how to safely get rid of the product when it's expired or no longer needed. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.